my name's Miranda and I'm going to be narrating through the physical assessment for you here today.
Hi, I'm Michaela. I'm going to be the student nurse performing the physical assessment. A physical assessment should take about 5 minutes, but for this video purpose we are going to take a little longer just to explain all of the procedures for you.
And I'm Jen, I'm going to be assisting her in giving a physical assessment.
First thing Jen and Michaela will do is go ahead and wash their hands.
Hi, my name is Michaela. I'm going to be your student nurse. We're just going to be performing a physical assessment today. Can you state your name and date of birth for me?
Yep, Melody Dixon, 3/22/92.
And hi, I'm Jen, I'm going to be the other student nurse assisting Michaela in giving a physical assessment.
And also I would just check allergy, because her allergy band.
Yep, I'm allergic to iodine, thank you.
Thank you.
So while Michaela will begin with the vitals, Jen will then go ahead and assess airway, breathing, circulation, any deformities, and equipment. So while Michaela begins to do the blood pressure, Jen will then go ahead and do the other assessment of the vitals, which is temperature and pulse. The blood pressure, you want to make sure that the cuff is below the level of the heart and is completely covering the arm. And for temperature, you want to ask the patient if they've eaten anything hot or cold prior to the temperature.
The blood pressure is around 120/80. This would be within normal ranges.
And you want to make sure that you place the temperature probe underneath the tongue in the sublingual pocket, and you want to make sure that they close their mouth for the whole duration.
The temperature is 98.6, which is a normal range.
Then, while the pulses are being taken, Jen will also discreetly count the respirations.
Pulse is 80 and respirations are in 16.
And that is also within the normal range.
We would assess the patient's pain. We would assess it on a scale from 0 to 10, 0 being no pain and 10 being the greatest amount of pain.
Also with pain, if the patient is experiencing any at all, then you definitely want to do some interventions with that because pain is assessed with the vital signs. Then going to do a brief neurological assessment. She's going to be looking to see if the patient's face is symmetrical. Is there any drooping? Can he raise both his eyebrows and can he stick out his tongue? Is there any loss of consciousness? And is he alert and oriented ×4?
Can you please state your name? Do you know what month it is? Can you tell me where you are? Can you tell me why you're here?
Then a Glasgow Coma scale will be assessed. 15 is the highest score, and that's what we would be aiming for. Then she will go ahead and do a Perla.
Pupils are round and equal. Reacted to light. And accommodation.
Now Michaela will be doing a respiratory assessment. There are 8 spots on the front. Each time she listens, she will ask the person to take a deep breath in. Then there are 4 spots to listen to on the right. And then there are 3 spots to listen to on the left. Then you will ask the person to sit up straight so that you can hear all of the 10 spots to listen to on the back. And then she will document any adventitious lung sounds that she may have heard and note what lung fields, inspiration or expiration, that she may have heard them on. Now Michaela will do her cardiac assessment. She will listen to all the heart sounds, starting with the aortic, right second intercostal space, pulmonic, left second intercostal space, Erb's point, left third intercostal space, tricuspid, left fourth intercostal space, mitral, left fifth intercostal space, midclavicular, apical. Now Jen will continue with the cardiac assessment. First she will feel for the temporal bilaterally. Once she gets to the carotid, she will be feeling one at a time. Moving down, she will be feeling for the brachial, the radial. While she's at the hands, she will be checking capillary refill on both sides. And she will be testing equal muscle strength. Now she'll be feeling for the dorsal. And if she can't find any of these pulses, then she will use a Doppler to find them. After Jen has asked the patient to push their feet against her hands to test the muscle strength, she'll be also looking for any edema that she might find. Now Jen will do a quick abdominal assessment. She's inspecting the abdomen for any distension or any abnormal skin markings. She's going to auscultate in all 4 quadrants, listening for any bowel sounds. She would note whether they are hyper, hypo, or within defined limits. There are 2 spots in each quadrant. After she has listened in all the quadrants, she will then palpate the abdomen very softly, noting any pain or tenderness. Now that Michaela and Jen have finished their quick assessment, they will lower the bed back down, ask if the patient needs anything, put the call bell within reach, and make sure the side rails are up, and wash their hands.
Melody, we'll be back in an hour. Do you need anything? No? Okay.
This is now the quick head-to-toe assessment all pulled together. Miranda has already done her vital signs.
Hello, my name is Miranda. I'm going to be your student nurse taking care of you today. Can I have you state your name and date of birth for me, please?
Jennifer O'Rourke, January 18th, 1992.
Okay, any allergies?
No.
Okay. First what I'm going to have you do is I'm just going to check your eyes real quick, and if I could just have you look straight ahead. Just going to listen to your heart. Can I have you take a deep breath for me? Okay, and I'm also just going to listen to the side as well. And if you could just sit forward just like that, thank you. Okay. So how is everything?
Good.
How's Joseph Jr.?
He's good.
Oh, good.
Thanks for asking.
Oh, you're welcome. All right. So I'm just going to take a look here. No pain or anything like that, right?
No.
Okay, I'm just going to listen first. Okay. Don't mind me, my hands are a little chilly.
It's okay.
You just let me know if anything hurts down here.
No, nothing hurt.
Okay. Thank you, Jeff. All right, and can I see? Just gonna, okay. All right, and can I see your hands? And what you're gonna do is you're just gonna squeeze. Perfect. All right. Alright, well, is there anything else I can get you in the meantime?
No, I'm fine.
Okay, you're comfortable, temperature, you need any other blankets or
No,
anything?
I'm fine. Thank you.
Alright, well, you're welcome.
Thank you for everything.
You're welcome. I'll be back in a bit to check on